Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then we have gastric ulcers. So we have a classification which is important for gastric ulcers, modified Johnson's classification of gastric ulcers. According to modified Johnson's classification of gastric ulcers, one the first gastric ulcer, actually it is of five types. Okay, type 5s. We will draw the pictures of each of them. Okay, so these are the five types of the modified Johnson's classification. So first, ulcer is present mainly on the incisura angularis. Okay, ulcer is present mainly. Okay. Ulcer is present mainly on the incisura angularis in the lesser curvature, and this is the most common type, and it has low acid secretion. Acid secretion is low in type 1. Then we have type 2. Okay, then we have type 2. In type 2, actually ulcer is present in the body of the stomach, and it is also present on the duodenum. So here you have two ulcers are present. Okay, one ulcer is present in the body, second ulcer is present in the duodenum. So because there are two ulcers, and this ulcer will cause increased acid secretion is high in type 2. Okay, there are two ulcers, one in the body and other in the duodenum. Then we have third type. Okay, sorry. Right, then we have the third type. Third type is actually a pre-pyloric ulcer. In pre-pyloric ulcer, it is present just below the pylorus or at the pylorus. That is, this is the pylorus. Within 2 to 3 centimeters of pylorus, you will see the ulcer. Okay, which is the type 3. Then we have type 4. In type 4, the ulcer is present mainly in the lesser curvature, most commonly at the gastroesophageal junction. This is esophagus, this is stomach. So it is present in the lesser curvature at the gastroesophageal junction, like this. So this is type 4. In type 4, because it is present at the gastroesophageal junction, it has less acid secretion. Whereas type 5, it can be present anywhere, and it is induced by the medications like NSAIDs. So this has low acid secretion. So these are the five types of gastric ulcers based on modified Johnson's classification.
thank you and thank you for watching.